So is that okay? Thank you. Hi, and welcome to this Dentsply Academy webinar, the 20 key uses of digital dental photography, with myself, Ian Klein. Just a little bit about me. I qualified at King's College London back in 1993. I'm a partner in a purely private cosmetic and general practice in central London. I'm also a lecturer on the aesthetic restorative masters at King's and the fixed removable masters at King's College London. I'm an opinion leader and advisor to a number of dental companies. I'm a very keen dental photographer and have been teaching photography for probably about 10, 11 years now. And I founded www.photographyfordentists.com a few years ago, which I'll tell you more about in a moment. And I'm also course director of Cosmetic Dental Seminars. Cosmeticdentalseminars.org is the website. It's an 8-day program in aesthetic restorative dentistry that I run in central London. So if you're interested in that kind of thing, then please visit the website. But tonight, or morning or afternoon, depends where you're watching this, the idea is to talk about photography. Now, I did set up this website, photographyfordentists.com, a few years ago. It's an excellent resource. It's completely free. You don't need to register at all. There's various downloads. There's handouts from lectures that I've given. There's useful templates that you can download. There's a consent form, which I'll talk about a bit later. There's settings for digital SLR cameras. There's a few videos on there, and also there's links to where you can buy things like retractors and contrasters and mirrors and so on. Also on the website, there's a link to a previous Dentsply webinar that I've done, which is the Art of Digital Dental Photography. Now, this webinar that I did was very much about the more technical aspects, so explaining things like aperture, shutter speed, different types of equipment that you need, and how to take all the useful views that I'll briefly describe. So if some of the things that I'm going to rush over in this webinar don't quite make sense to you, the best thing to do is go to the Art of Digital Dental Photography webinar, and you'll get the information from there, I'm sure. Or alternatively, please feel free to drop me an email. My email address is my name, Ian Klein, @mac.com. As long as it's a brief email, I'm more than happy to take questions by email. The other thing you can do as the webinar progresses is that you can just type in questions. I'll take some questions as I go along, if they're particularly pertinent to this part of the webinar, and I'm certainly happy to take 5 or 10 minutes questions at the end. Now, what I'd like to do is just break this webinar down into several parts. First of all, talk about the aim of good dental photography. Then we'll talk a little bit about consent, talk a little bit about the equipment that you need to take good photos, a little bit about theory and what useful views you might take. But I'm going to spend most of the webinar, which will be about 50 minutes or so, talking about the uses, the 20 uses of clinical dental photography, and then we'll round up with where to get more information from. So in terms of the aim and what I would consider good dental photography, as in this clinical photo, it's 3 things really. It's focus, exposure and framing. So focus as in everything is nice and sharp within the photograph, that the image isn't too light, it isn't too dark, and that the image is correctly framed, that we've only taken a photograph of what we're interested in and nothing else. And the other key, I think, with dental photography is reproducibility. So we can take a case like this with some severely worn teeth and restore those teeth, in this case using the new Ceramex SphereTech composite from Dentsply. This case that I did, the reason I show these photos really is to show reproducibility, is that we have a before photograph and we have an after photograph, and everything is the same apart from what we've done to the teeth. Or in this case, where we've replaced some failing restorations with some ceramics mono restorations. The reason I show these is to show reproducibility in the photography, and I think that's absolutely key. Now, when it comes to taking photographs, you should always be considering how you might use those photographs in the future, and you should also be thinking about consent. On the photographyfordentists.com website, I've put together a nice consent form. This is in a Word document format if you're a PC user. It's also in a Pages format, and you can just download this, amend it as you see fit. So if you're going to put photographs, let's say, on your website, or perhaps have photographs in your waiting room, you do need to be getting proper written consent from your patients. Now, in terms of what equipment you need, three things basically. It's a digital SLR camera, 100mm macro lens, and a ring flash. It's also possible to use a 60mm macro lens. The 60mm macro lens acts pretty much like 100mm on most of the digital SLR bodies that you might be buying for clinical photography. A ring flash, I would say, is fairly essential, particularly for posterior work. It's fashionable now also to be using dual point flashes, which I think are great for anterior work, but really for posteriors, nothing beats the ring flash. And in UK terms, cost-wise, you're probably looking at about £1,100. Most of that cost will be on the macro lens and the ring flash, with the actual body, the digital SLR body itself, being relatively cheap. Something like the Canon 1200D, which is very much the entry level, or if you're in America, one of the Rebel series, basically the cheapest Rebel, Canon Rebel that you can buy. The macro lens, as I say, you could use a 60mm lens, which will save you perhaps £100 or so. The ring flash, the Canon ring flash, I would say, is by far and away the best on the market, but there are various copies, sort of clones as you like, which you can buy from Amazon just by typing in ring flash for Canon or ring flash for Nikon. You'll find cheaper copies that seem to work okay. Other equipment that you need, certainly some cheek retractors, such as these ones here. They can be self-retracting or two separate retractors. I personally prefer two separate retractors. Something called, you might not have seen before, this, which is a occlusal retractor or a lip retractor, and this very much helps when you're taking mirror shots. So this is called an occlusal or a lip retractor. Certainly to have a mirror, and it's useful to have a mirror handle just to keep your fingers out of the way, and some contrasters, which are basically just little black paddles which can be placed behind the teeth just to give you a nice black background, as well as looking nice in your photographs. The other use is for showing things like incisal translucency. So say if you're wanting to communicate with your technician, a central incisal translucency, so you can match a crown to it. You can put one of these black contrasters in, and the things like the translucency shows up much clearer than without. So the key points really, the digital SLR is very much the benchmark for clinical photography. You really should be thinking about getting a ring flash. I have seen dentists trying not to use flash or just to use the pop-up flash, but the results are never as good. And you need to budget a little bit for some retractors, some mirrors, and some contrasters. Now, in terms of theory, And this I explain in quite a lot of detail in the other webinar that I've done for Dentsply, The Art of Digital Dental Photography. But settings-wise on your camera, you should be using manual settings, manual exposure settings, a shutter speed of 200th of a second, and an aperture setting of f22 or even smaller. So anything in the range of f22 to f32 will do the job for all of your smile views and also your intraoral retracted views. The other key, I would say, in terms of theory is using magnification ratios. The three typical views that we'll be taking of patients are portraits, smiles, and close-ups. And everything really is a variation on these three views. So, for example, an orthodontic series would just be that first photograph on the left, but with the patient positioned in a profile and positioned in a three-quarter profile. A smile view, whether it's a smile from the front or from the right or the left, all of the views will be the same size straight out of the camera. Also, mirror views, upper and lower occlusal views, will all be the same size straight out of the camera. And the way that we can achieve that is by using magnification ratios, which is something that you set on the barrel of the lens, and it's really essential to use this if we're going to have reproducibility. So all focusing is done manually once the magnification ratio is dialed in. And really, I'm just mentioning this now as a reminder, but if you need a full explanation of magnification ratios, again, go back to the Art of Digital Dental Photography webinar. Now, the magnification ratios, you also need to remember whether you have a full frame sensor camera or a small frame sensor camera. So a full frame sensor camera would be 35 millimeters in diagonal, which is the same as old film, and so cameras such as the EOS 5D Mark III would have a full frame sensor, whereas something like a 400D would have a small sensor, a 650D and so on would have small sensors. And if you do have a small sensor on your camera, which I suspect most of you will, you would use a magnification ratio of 1 to 3 for a smile and 1 to 1.5 for a close-up. Whereas if you have a full frame sensor camera, you'd use 1 to 2 and 1 to 1. So 1 to 2, the whole photograph here, that would be on a full frame sensor camera. Whereas if I used a 1 to 2 setting on a small frame sensor camera, I would actually end up with the photograph masked, sort of marked out there in yellow. So it's a little bit confusing sometimes, but if you want more of an explanation of magnification ratios, go back to the Art of Digital Dental Photography webinar. But it is something that you need to use to have reproducibility. So the key points really here are the importance of depth of field in your photography. So certainly using an aperture setting of f22 or smaller than f22, so f25 or f32, to get everything into nice sharp focus. You want to be using a macro lens, typically 100mm macro, although you can use 60mm macro lenses. And to get reproducibility, you should be thinking about using magnification ratios. It's the only real way of achieving that. So in terms of views and what views you might take, as I've said, reproducibility is the key. So we can have a series of photographs, say on the top here, where we've done some whitening, before whitening, and some after whitening, and everything is the same apart from what we've done to the teeth. And the way that we can achieve this reproducibility is by using the same magnification ratio each time, and then the same direction of photograph and the same framing. So we always center on the same point, and we always frame in the same way to get this reproducibility. But it's key to use the same magnification ratio. And one thing that I put onto the photographyfordentists.com website is these 12 views. So we have a portrait, and then a smile, a right and a left smile view, and then an anterior retracted at number 5, a right and a left retracted, then some close-up views, and then an upper and lower occlusal view. And these 12 views, if you can take these 12 views, you can pretty much take any photograph in dentistry. Because, for example, an orthodontic series would all just be a variation on view 1. So the key points really is that, as I keep saying this word reproducibility, that's absolutely key, I think, in your clinical photography. And we get that by using the same magnification ratio each time for the photograph and correctly framing. Now, I'm going to spend most of the time now talking about uses of clinical photography. And if you have any other uses on top of this list, then by all means drop me an email. But this was the list that I could come up with. So we talk about medico-legal documentation, which I think is by far and away the most important thing to get correct. We have monitoring of conditions, we have lab communication, we have professional education, treatment planning, patient communication, patient education, co-diagnosis, digital case presentation, practice portfolio, professional portfolio. We can use photography for our marketing images. I think we get better as dentists the more we photograph our work. We can use photographs for specialist referrals, for orthodontic referrals, for Invisalign consultations. We can use it for staff training. We can use it for copying radiographs. We can use it for computer imaging, professional examinations, and for entering awards and competitions. So what I'm going to do is spend the rest of the webinar talking about each of these in a bit of detail. So as I've just said, I think medico-legal is probably the number one reason why dentists should be taking photographs. It's particularly important, I would say, in the UK at the moment, where we seem to have a very litigious society when it comes to dentistry. So cases like this on the left, where the patient comes in, she's fallen at the swimming baths, at the swimming pool, and fractured her upper left one. It's quite nice, as well as having a written record and obviously a radiograph of the tooth, to have a photograph. You know, the photograph just tells you everything about what's happened to this tooth. And then obviously we have an after photograph here where we've reattached the fragment. So it might be sometimes with medico-legal photographs that it's to cover yourself. So in cases like this, where patients are coming in on the left here with nifedipine hyperplasia, on the right with acute necrotizing ulcerative gingivitis, ANUG. It's really nice to have these records of the patients. Patients forget, I think, quite what a state they were in sometimes as treatment progresses. So it might be that you're covering yourself. It might be the patient is litigious about a previous dentist. It might be, as in sort of cases of trauma, that they're litigious against, say, an assailant or something like that. But I think having these kinds of records for medico-legal, I think, is really important. Monitoring of conditions. So this is things like tooth wear. So we've all got patients with tooth wear where we say, oh, let's just monitor this. We won't actually do any active treatment at the moment. In cases like this, which we did actually do some active treatment before he'd worn his teeth away completely. But in these kinds of cases of tooth wear, we can certainly take study casts, so we can have serial study casts, but also clinical photographs I think are really helpful. Things like recession, again, our clinical record where we might make a note, upper left 3, there's 2 millimeters or 3 millimeters of recession. If we can photograph this and attach this to the patient's record in some way, I think it's very helpful for when that patient comes back year on year. We can just pull up the photographs and see whether it's actually got any worse or whether it's stayed the same. So I think particularly tooth wear cases, recession cases, this is somewhere where I use my photography. Laboratory communication, I certainly wouldn't want to work with my technicians without the use of the camera. Obviously, the ideal is to have a laboratory on site or a laboratory around the corner where the patient can just pop in for shades. But most dentists don't have this luxury. So the minimum we should be doing is sending at least 1 or 2 shade tabs in the photograph. In this case, we have provisionals on the 2 central incisors. So we're going to take a shade from the lateral. I seem to think that it's an A2 neck, it's a B1 body and incisal shade. So I place my shade tabs as close as I can to the tooth that I'm trying to match, so that the shade tabs are illuminated in the same way as the tooth. And in a case like this, I would take a pre-op. What we're going to do here is we're going to replace this failing porcelain bonded crown on the upper right one. So what I would do is before anaesthetic's given, I would take a base shade, which is a B2. I would then perhaps put some other shade tabs in if I wasn't quite certain that it was a B2. So the middle photograph there. I would also take a photograph of the prep, in this case with a stump shade tab in place. This is for, I'm going to be putting an Empress crown on this tooth, so this is an Empress stump shade tab. And I would send these 3 photographs to the technician. And that's what they managed to do. So in this case, this upper right one, Empress crown, that's what they managed to do in terms of shade match, just from the photographs. One technique that I've been using recently, actually not recently, the last few years really, for communicating with the technician has also been something called cross-polarization, which is basically sunglasses for your camera's lens and sunglasses for your flash gun. So typical photograph might look like this, and what you'll notice is that there's lots of glare on the teeth, and which you'll get from a ring flash. So a dual point flash tends to put light on the line angles of the teeth, whereas ring flashes for anterior shots, you tend to get quite a bit of glare coming back. And it's not ideal when you put shade tabs in there and you're trying to take a shade off a tooth to have all this glare on the tooth. So a cross-polarizing filter, which this photograph was taken with, basically takes all the glare off the photograph. So it becomes, and also off the shade tab, so it becomes much easier to take a shade. So this is before, just a regular photograph, and then after with a cross-polarizing filter, both on the lens and on the flash gun. And there's a commercial product available which is very nice, something called Polarize by Bioemulation. But if you just Google Polarize, a few places sell it. And what this filter does, it just clips on using magnets onto the end of the onto the ring flash, and part of the filter will cover the lens, and the other part of the filter will cover the ring flash. And what this is you have a polarizing filter over the lens, and you have a polarizing filter which is polarizing at right angles to the one covering the lens, and that will give you this photograph. Okay, so it just makes it easier. It makes it easier, I think, to determine particularly the value, and it helps taking the also with the hue and the chroma to have all this glare taken out of the photograph. So that's the polarize. Now, professional education as a use. More and more general dentists are delivering webinars, are writing articles, and so on. And one of my big bugbears is when the photographs aren't very good. So this photograph I took for a series for Dentsply, I think probably about 4 or 5 years ago now, which was for the launch of SDR. And what it's quite nice to be able to do is to take a series of photographs and have, as I said earlier, everything the same apart from what we've done to the teeth. It becomes much easier, I think, trying to explain procedures to other dentists if your photographs are nice and clear, and then it's very, very clear what's gone on. And so that series of photographs was used in the how-to guide for posterior direct composite restorations, as I say, when SDR was first launched. So certainly professional education, I think, is very important to have good clinical photos. Clinical photography certainly helps with my treatment planning. So a case such as this, sometimes we only have short periods of time to talk through cases, and we perhaps might miss things if we're trying to rush through a treatment planning with a new patient, for example. So what I like to do is take a series of photographs at that initial appointment, certainly a smile, right, left views, perhaps a portrait, as I'll talk about a bit later, some upper and lower occlusal views will show a lot. And perhaps don't spend so much time talking about the actual details with the patient of what you're going to do for them. Talk in some general terms, and give yourself a bit of thinking time, really. So when the patient then leaves, they'll reappoint for another consultation. And what I can do is I can then go back and look at the photographs that I've taken at the end of the day and start to, see everything, map everything out. So I'm ready for when the patient comes in next. So really useful for treatment planning. Also really useful for patient communication. So cases like this, where a patient might be considering having amalgams replaced, you can show them examples of cases that you've treated before. So in this case, on the left, obviously with some amalgams and replaced with some, I think this was a ceramics mono case. Patients, if they like to look at pictures, perhaps not so much intraoral ones, perhaps they like to look at more smile views and things like that. But if they're considering having their amalgams replaced, show them some cases that you've done before, okay? And, educate your patients. So a case like this, on the left, where the patient has a diastema and is wondering what the possibilities are, then yes, we can do direct mock-ups, we can do computer imaging. It's also useful, I think, to inspire confidence, to show them a before and after of a case similar to theirs. I find it's quite useful. Things like tooth whitening. We should all have photographs like these on our websites, in our treatment rooms, in our waiting rooms, to get patients excited about what the possibilities are for aesthetic work. Co-diagnosis. So this is where I will take an upper and lower occlusal view of the patient. And rather than using an intraoral camera where I might go around the mouth and just take photographs of individual teeth, I'll take a whole arch photograph with my digital SLR camera. And then what I'll do is I'll put these on the computer screen and then just walk the patient around their mouth. And I'll just zoom in. It's quite easy to do this now on the computer. Just zoom in on certain areas that I'm interested in. And what you'll find is that the patients will start pointing out other areas that they're concerned about. So I might be interested in talking about their gold inlay on the upper left six, but they'll start pointing out, the upper right fibre. What can we do about this? What can we do about that? It's very, very useful, I think, to get the patients involved as much as you can with their treatment. And when the patient sees their whole mouth like this in front of them, they often end up diagnosing more work for you. And that leads us on to a digital case presentation. So we'll walk through with the patient with their upper and lower occlusals. We'll also, perhaps if it's an aesthetic case, we'll have a bunch of anterior views. And then we can put all of those photographs in a digital case presentation. So this is using something like PowerPoint if you're a PC user, or Keynote if you're a Mac user. And you can basically put together a bunch of slides. Doesn't really take very long, take 5-10 minutes. You can annotate the slides, you can put lines on, you can put text on. You can put your fees into the digital case presentations if you desire as well. You can put computer imaging photographs, as I'll talk about later, into the digital case presentation and package all that together. You give it to the patient as a PDF or on a memory stick or email it to them. Developing a practice portfolio, I think, is another use for clinical photography. And this is something that you can have on your website, something that you can have in your waiting room. And a practice portfolio, I think it really works well for aesthetic dentistry. So showing portraits of patients, showing before and after smiles of patients. Every patient, even if they're not kept waiting very long in your waiting room, will pick up one of these binders and start flicking through to see what kind of dentistry it is you're doing. And although there are some great books out there, such as Change Your Smile by Goldstein, the best thing to do, I think, is to show examples of your own work. So the photographs need to be good. They need to be sort of genuinely, before and after, and that all you've done is do the dentistry and the photographs look the same. And I wouldn't show any gory pictures. So don't show pictures of surgery, wouldn't show pictures of sort of tooth preparations and things like this. The practice portfolio, it's all about, you might show some close-ups of maybe some amalgams being replaced, as I showed you earlier, but no gory photographs. Patients don't want to see that. Patients certainly don't want to see any blood. A professional portfolio, on the other hand, this is where you would show things like your tooth preparations. It might be that you show your surgery. There's blood in the photographs. It doesn't really matter. A professional portfolio is something that you would take along if you're looking for a new job, for example. Certainly years ago, when I was looking for associate positions, I took a portfolio with before and after photographs of cases that I treated, and it was surprising how few other dentists took that trouble. I think more and more dentists now, though, are taking the trouble to have portfolios. So you'd certainly have, your smile views, but you perhaps have views of your preps. You'd have photographs of posterior work that the patients might not be so interested in, but a prospective employer would be interested in. We can use photographs for marketing images. So this is things like your website. So in this case, this is from my practice, the Bloomsbury Dental, where we have before and after photographs of tooth whitening on the website. We have veneer cases. We have a whole load we have orthodontic cases, all sorts of restorative cases, tending to be smile views. And these photographs, ideally, you want consent. Even if the patient can't be identified, really get written consent if you possibly can for these kinds of photographs. Self-improvement, so on 13 out of 20 now. Self-improvement, I think there's no question you get better as a dentist the more you photograph. So in this case, this patient was referred to me by a periodontist with a very large diastema between the upper left 1 and upper left 2, and she'd actually been treatment planned for multiple veneers elsewhere. And I said, well, actually, I think we can probably do something just with some composite. It's not going to be perfect, but I think it will achieve what you want to achieve. So in her case, what we did was did some composite. So what we did was we obviously closed the diastem with composite onto the 2 and the 1. We did a bit of reshaping of the mesial aspect of the 1 and a little bit of composite on the mesial aspect of the upper right one. So we took her from there to there in one appointment. She's thrilled because actually, although it's not a perfect result, she's thrilled because it's cost her far less in terms of financial, and it's cost her far less in terms of biological cost to the teeth, the fact that she didn't have veneers put on. I like this case because when I zoom in on the composites and I really get close to those teeth, and then you can hardly see the join. You can just about make out, I think, the join here. In this case, I think I did with Aesthetics HD. This is probably from about 6-7 years ago, this case. But it was only really when I started photographing my cases and then showing them to other dentists, critiquing my own work, that I think I got better and better as a dentist. So certainly photograph your work, it can only improve. Specialist referrals, certainly the specialists that I work with like having photographs emailed over to them. So in a case like this, we've got an in-standing upper right 2, patients interested in orthodontic treatment, so I can email these over to the orthodontist. Patient doesn't have to go anywhere. Orthodontist can give me an indication as to treatment times, treatment costs. It's an extra service to your patients that you can say to them, okay, we'll email these over to the orthodontist and get some answers for you. So, and the same with the periodontist, I'll refer, say maybe if it's, let's say, a surgical crown lengthening case, I'll take photographs and email over to the periodontist and get some ideas. Also things like lumps and bumps, in this case just on the soft palate here. We can then send this over to the oral medicine people at the local hospital, and again they like sort of having photographs sent over as well as descriptions. More and more general practitioners now are doing orthodontic treatments, and it's certainly useful to be able to take orthodontic views of your patients. The minimum that you want to be taking is this kind of view, just an anterior view, but ideally a profile and a 3/4 or 45 degree profile. This is the standard orthodontic series, and you'd have it with the patient smiling, and having with the lips also at rest. Staff training, something I use the camera for. So things like I like my, say, composite tray to be set up in a particular way. So I would have a photograph in the surgery manual, just explaining what I expect to be on my composite tray or to be on my root canal tray. And we just take a photograph of that once, and then that's there as an aide-memoire for my current nurse. Also, if we then take on a new member of staff, it's all there. We don't need to run through it all again. In my surgery, we have a separate decontamination room, so we took photographs of the room to show the zoning, to explain the zoning in the surgery. And again, that's in a binder. So if we have, say, temporary staff come in, they can just quickly look at the binder and just see how things run in our practice. So it's useful to have the camera there for that. Copying radiographs, number 17. I know a lot of dentists now have gone digital, but if you haven't gone digital yet and you want to digitize a radiograph, one way of doing it is to take a photograph of it. You might want to have a digital copy so you can send it to other dentists. You might want to send it to specialists or to a referral hospital. You might want to show the radiograph on a computer monitor, so you can show it enlarged, so you can show it to a patient to explain something. And the way that we do this is quite simple. We put the radiograph onto a light box, ideally, or we can use it if it's daylight. We've got some bright light coming from outside. We can just tape it to a window. We'll focus manually on the radiograph, but we change the settings on the camera. You need to turn the flash off, so we don't use any flash, and we set the camera to aperture priority, or AV mode, or A mode, depending on your camera, and we'll set an aperture of 5.6. So we don't need any depth of field, so something like 5.6 with a light box or with bright daylight streaming through the radiograph should get us a nice exposure. And so that's how we copy radiographs. Another use for clinical photography in my practice is cosmetic imaging or digital imaging. And this basically is where we take a photograph of a patient on the left here, and we digitally image, or we alter the teeth digitally on the photograph on the right here, using something called a Wacom tablet and pen. So you can basically draw in a new smile, and this allows yourself, the patient, and the technician to visualize proposed treatment. So this is an example of a computer imaging. So what we've done is we've taken a photograph on the left, we duplicate that photograph, and then we can draw in a proposed new smile. Now this might be we're proposing veneers, crowns, orthodontic treatment, anterior composites, whatever treatment, doesn't really matter, because you can pretty much image anything. And there's not been many studies on this, but one of the studies that I came across, which was from the Journal of the American Dental Association, they looked at consultation methods and treatment acceptance when it came to diastema closures. And what they showed was, if you just show a patient a wax up, that 26% of patients accepted treatment. If you showed them before and after photographs of similar cases, then 42% of patients accepted treatment. If you did a direct resin mock-up, So just taking some composite, not etching or bonding the tooth, but just placing composite onto the teeth, and then zapping it with your LED light and showing the patient in a mirror. That about half of patients decide to go ahead with the treatment. But if you showed them a portrait photograph of themselves with a proposed, so digitally altered teeth closing the diastema, that 88% of patients accepted treatment. So by far and away the most successful method for getting acceptance, and I think importantly understanding of treatment, was with computer imaging. And the key, I think, is to be able to deliver though. So in this case, one of my cases, took the patient's photograph. Patient didn't like the diastemas, didn't like the gaps, didn't like the amalgams that come from the periodontist to me, so they're periostable. So what I did was I basically mocked up digitally, closing those gaps, replacing the amalgam with composite, and doing a composite veneer on the upper left 4, and the same on the upper right 4. And we did this all just with composite, so this is the actual result. And I think as long as your actual result is as good, if not really ideally better, than your digital imaging, then you won't run into problems. I think people run into problems with digital imaging if they almost paste in a new smile into somebody's mouth where they can't deliver, normally for anatomical or perhaps financial reasons or biological reasons, that they can't deliver that outcome. So you do have to be careful with computer imaging, but I think as long as you're careful, it works very nicely. Other uses for photography, certainly professional examinations. In the UK, you might be thinking of doing one of the diplomas from the Royal College of Surgeons, or you might be thinking of doing accreditation from somewhere like the British Academy of Cosmetic Dentistry. These bodies both require good clinical photographs. If you're thinking about doing something like a master's at King's College, we require good quality photographs of cases that you've treated. And then that brings me finally to number 20, which is awards and competitions. So certainly in the UK now, we're seeing lots of this. Various publishing houses and other bodies are looking for dentists to enter awards and competitions, to win awards, I should say, such as this one from the Aesthetic Dentistry Awards. And they'll expect really high quality dentistry, but also high quality photography. So I would say the key points and the uses, we've just got sort of 5 minutes or so left. Certainly medico-legal, I think, is the number one reason for taking good clinical photos. Developing portfolios, both practice portfolios and professional portfolios, really important. I certainly wouldn't want to work without a camera to communicate with my technician. And I think also very importantly, self-improvement. I think the more you photograph your work, the better you get as a dentist. So the last little thing I wanted to talk about was just where to get more information from, and some books that I'd recommend. And if you do have any questions about photography, about the uses of photography, please do just type them in now and I'll answer them at the end. So where to get more information from? There's one really good general book on photography that I would recommend, which is John Hedgecoe's The New Manual of Photography. It's only about £25. It's actually quite a thick hardback book, very high quality photographs in there. It explains all the theory about different lenses, about apertures, shutter speeds, flash guns. It explains about how to get creative with your photography. Really nice book, John Hedgecoe. The best dental book, or dental photography book I should say, is Mastering Digital Dental Photography by Wolfgang Bengel, German dentist. It's quite an expensive book though, it's about £120, and that's from Quintessence Publishing. So that's Mastering Digital Dental Photography. And the last thing, just for anybody who came late to the webinar, is photographyfordentists.com. You'll get the consent forms that I've talked about from that website. You'll get the useful views as a template, so you can just print that out and laminate it and have it in your surgery as an aide-memoire. There's a 41-page handout in there that will explain how to take all the different photographs and how to frame the photographs and where to aim. There's an explanation about apertures and shutter speeds and so on. So that's all at photographyfordentists.com. So what I've done is I've talked about really what is good photography. I've talked a bit about consent. I've talked about what equipment you need, the theory, useful views, and also the many uses of clinical photography. So hopefully I've inspired some of you to buy cameras and some of you to use your camera more often. And I'll put up my my email address there, which is my name, ianklein@mac.com. So